Health experts, various civil society organizations, religious bodies, and other key stakeholders raised concerns over the possibility of a spike in active cases of COVID-19 as political parties commenced full campaign activities ahead of the elections. The Ghana Health Service, at the time, estimated that majority of the citizenry were not wearing the face mask, with others wearing it inappropriately. Despite cautions from the president to Ghanaians to put on the mask during rallies, many could be sighted without a face mask and with total disregard for the social distancing protocol at rallies organized by both the NPP and NDC. During voting, some polling stations had voters in queues breaching the health safety precautions. According to the Ghana Health Service, this is likely to increase the spread of the disease, hence the need to intensify surveillance and testing as immediate steps to curb its spread.
There are potential points where there were large jubilations, where there were queuing, among other things, and so the district there will enhance surveillance to ensure that anybody who reports any similar condition are quickly picked up and identified. And of course, we intensify our testing in such areas at the least sign that we find. So those are the areas we are talking about. But the most important thing is that if people abide by the protocols now, we will be able to minimize whatever possible surge we have. We have a chart of many countries that had an increase in their COVID situation after election, but there are also many other countries who were able to contain and actually brought it down. Korea is one of the examples, and so we are trying to adapt the same mechanism that we are doing.
He also bemoaned that post-election activities such as Christmas and school reopening also have the prospect of spreading the virus. The Ghana Health Service urged the public to intensify compliance with the health safety protocols.
What are the risks for the post-election and the Christmas? I'll mix them up to tell. For the Christmas, there's going to be increased commercial activities, and that obviously increases the risk of spread. And especially where we have the majority of the cases in Accra, and commercially people are coming to Accra to buy and go and sell in the other towns, that creates another area that we need to be careful about. So these are some of the risks, that's the reason why we need to up the game as far as the use of protocols are concerned. There's going to be increased travel within. Around the Christmas time, people are going to crisscross the country, and that's another risk. There's also increased social activities and gathering for Christmas. People are going to have parties and meet, and these are all the spots that we need to look at to ensure that we don't have the spread. For the election, our challenge is that the queuing for voting. Fortunately, I went around a bit, and I also had a Ghana Health Service also distributed, gave electoral commission some masks to give people who don't have masks across the country. Queuing is a risk.
Currently, Ghana has a total of 52,844 confirmed cases with 897 active. The death toll stands at 327. According to the Ghana Health Service, 67 districts in 13 regions have the active cases, with the majority of them from the Greater Accra region, Eastern, Volta, and Western regions.